Hi everybody, my name is Eddie and I will be discussing the safe uses of lithium. This video is intended for college-age students recently diagnosed with bipolar 1 disorder and prescribed the mood stabilizer lithium. Lithium comes in two generic forms. I'm going to point to them here: lithium carbonate and lithium citrate. The two name brands I have listed here are Escalith and Lithabid. This image to the right here, specifically, I'm going to get my pointer right here, this manic nerve cell in your brain. This shows the two elements of bipolar 1. This is the depressive side, since this is a manic depressive disorder. This video will be focusing on lithium use for this one right here, mania. Alright. Okay, so in this slide we're going to be covering the core objectives. And we're going to look at this quote right here. There is a strong correlation between a patient's knowledge of lithium and safe therapeutic use. This video is going to focus on these four key objectives. So to instill this sense of knowledge so that lithium can be effective for you, we will talk about how to take lithium and what to avoid, facts you will be later asked to recover. We will instill an understanding of what it means to be in lithium therapeutic range and how this affects safe use. We will also discuss evaluating side effects, essentially distinguishing common side effects from serious side effects, and what actions you can take to manage them. We will also discuss activities that you can do to improve your treatment. I will offer examples, but you should also consider what you could create and commit to bring about a healthier lifestyle. Okay, so by the end of this video, these research learning. Okay, so we're going to examine the purpose of lithium therapy with the treatment of bipolar 1 disorder. Understanding mania is a critical component. Mania is characterized by intense mood swings and hyperactivity lasting over 7 days. Signs include less sleep, poor judgment, pressured speech or talking fast, and psychosis. Symptoms that you may experience that are unobservable to others would be racing thoughts, mood swings, and a lower appetite. Treatment with lithium inhibits chemicals in the brain causing mania. Used clinically, it's very effective. It's been used clinically for 70 years. Safe use correlates with client's knowledge, and initial blood work is required before treatment. This probably would have already been done for you. I'm assuming that you're leaving some kind of inpatient facility. So you're looking more in the therapeutic range of this treatment. But anyway, taking lithium as prescribed is essential to treating bipolar disorder. Cannot stress that enough. The desired outcomes of the lithium use are, of course, going to be better sleep, better judgment, and better concentration. All right, so we're going to look at the first of the four key objectives on this slide: how to take lithium and the do nots. Made up a little mnemonic, so we'll call these ATTs, like call ATT. Amount is going to be 450 milligrams twice a day. Usually don't exceed more than 1,200 milligrams. This is typically what's being prescribed. And time, take this at the same time every day. And tablets, this comes in a immediate release and extended release tablets. Extended release tablets cannot be crushed. We'll cover that down here. Always take by mouth with 6 to 8 ounces of water. Can also be taken with food or milk after meals. And this is recommended to avoid like nausea and some other common side effects, and also like over time to like reduce like stomach cramping or pain. Staying hydrated is very essential, as this you can see in the background here. These are the lithium tablets. This is lithium salt, like the element. Staying hydrated is essential because it's a salt, and you guys already understand the dynamics of sodium in water. It's very similar. Need to understand that we do not crush extended release tablets. Do not stop taking lithium because symptoms improved. This is a very common occurrence. Lithium makes you feel better, and you should just keep taking it because you're feeling better. It's proven its effectiveness. When you stop lithium, bad things happen. Do not consume coffee, tea, and cola. This is going to increase urination, which is going to make you eliminate the salt faster. Do not take if you are pregnant or nursing. This is a category D drug, which means that it's been proven that it impacts fetal development. Do not take with alcohol, marijuana, or illicit substances. These will impact lithium's effectiveness because they are affecting brain chemistry. Also, do not take St. John's worts. This interaction will cause fever, seizures, diarrhea, and shivering. Okay, we're going to continue looking at precautions and medications that affect lithium. Precautions are things you would have discussed with your provider, things you need to know beforehand before taking lithium. Lithium is a black box warning label. It means it has a small therapeutic range, so too little is ineffective and too much is toxic. Avoid exercises that make you sweat excessively, so saunas and intense exercise in the heat. Report history of suicidal thoughts and attempts. Report history of kidney and heart issues. Please be aware of how much you're drinking and how much urine you're producing. Make sure that you have an adequate amount of salt in your diet, so low sodium levels are dangerous. Schedule frequent clinical checkups ahead of time. So schedule lithium blood labs every 2 to 3 months. Seek behavioral health services and use contraception before taking lithium to avoid pregnancy. So these 3 medications are very important and should be avoided. They increase lithium toxicity. High blood pressure medications like Diaril, these are medications that make you, pee in high volume. Anti-inflammatories, these are going to be over-the-counter meds, aspirin, ibuprofen, and Advil. Heart and blood pressure medications to avoid are beta blockers, propranolol, and ACE inhibitors, Lotensin. So others, drugs to be used with caution are going to be SSRI antidepressants. And since we are treating a psychoaffective disorder, this definitely needs to be addressed thoroughly with your clinician. So avoid Zoloft, or not avoid, but just be cautious about it. Anti-seizure medications, phenytoin, which is Dilantin, and antibiotics can also affect lithium toxicity. So tetracycline or sumimycin. Other medications that make lithium less effective are going to be antipsychotics, which also kind of come with bipolar treatment. So please be aware of these that are most at risk of decreasing lithium's effectiveness. So copazine, thorazine, and Serentil. There's also others, but these are the ones I've listed. Stimulants to avoid, they also lower lithium effectiveness because they make you pee more, and that's going to be caffeine. Okay, so moving on to understanding therapy compliance. Now for lithium compliance, the takeaway here is that, this little mood wave, this is where you want to be, this is kind of expected. You're going to have bouts of hypomania, you might have bouts of mild depression, but overall, it's not going to be as bad as what you've experienced, we anticipate. So, setting reminders for your phone is really, really important, and that's going to help you with staying on time with regular doses. Some other factors that affect noncompliance are understandably negative attitudes. Mental health definitely has a stigma. These should be discussed in a support group or with your provider. Also, comorbid substance abuse is an issue that kind of renders people from not taking their lithium. It also makes lithium less effective. So avoid alcohol, marijuana, and illicit drugs. We covered that earlier. Cannot stress that enough. Also, shared decision making with your prescriber is important for compliance. There have been studies to determine that dialoguing with your provider so that any changes that you feel you have to make are addressed with your provider rather than you just making them on your own and then falling off or feeling pressured by your provider to take something that falls outside of a regimen that you can adhere to. All right, so continuing with therapy compliance, monitoring lithium levels for safety and effectiveness. So ideal ranges, like our little Goldilocks zone for therapy, is going to be 0.6 to 1.2. Anything less than 0.6 is not effective. Anything above, 1.5 really is toxic. So, but typically this is your therapy range. So 1.2 to 0.6. The effectiveness of lithium can take 1 to 3 weeks. It takes a while to build this up in your system. If you're newly prescribed this is what we're looking for. If you're leaving an inpatient hospitalization, which may be very much the case for most of you, then this would have been addressed before they let you go, and you're already in therapeutic range. Lithium affects the kidneys. This means that you're going to increase your urination, which can lower lithium's effectiveness. So you have to be careful of this. While you have to stay hydrated, you don't want to be excessively hydrated and removing, the salt from your body. Another important indication is that half of lithium taken is gone within 7 to 20 hours. This is why it has to be taken regularly at the same time to keep these levels in our Goldilocks zone. All right, now, we just covered that lithium. I can't stress it enough, I suppose. Lithium has a narrow therapy window. Again, too little is ineffective. Too much can be toxic. Routine blood work, make sure we're getting this done every 2 to 3 months. So be mindful. This slide are things that we cannot stress enough. All right, so for this slide, we're going to be looking at some visuals because I understand that people have different learning styles. So, this is going to be for your visual learners rather than your auditory ones. Understanding the therapy range of lithium treatment. This is kind of what we were talking about. This is your Goldilocks zone. This is your maintenance. And also, treating acute mania, probably when you're in the hospital, they're hitting these ranges. So this can drop a little bit, but it's still above 0.6. So also looking over here, wanted to discuss this side effect in particular, nausea and diarrhea. This is a very common side effect. It doesn't happen to everybody, but of the side effects to occur, this one's mild. Again, there's another one that's worse, but there's a mild nausea and diarrhea. This can be managed. So you can take this with food, again, after meals if you're not already doing so. You can also divide the daily dose. This does not really apply to extended release tablets. If these this is if you're like taking the regular immediate release tablets. Then you can also switch to the sustained release tablets. So this is going to help you reduce those feelings of nausea and help remove that strain on your GI tract. Okay, moving on to our third key objective, distinguishing common side effects from serious adverse effects. Now, this is a very exhaustive list, so I would encourage you to hit the pause button, take a moment to take this in. We are only going to be looking at 3 common side effects during treatment and 3 serious side effects that are related to lithium toxicity. Okay, continuing on with the key third objective, we're going to be managing 3 side effects here. So a common side effect is mild thirst and dry mouth from lithium. Easy fix, drink more water. You should be drinking half a gallon to 3/4 of a gallon of water every day. Also to manage constipation, improve your nutrition, increase your daily fiber, and that means eating more fruits, leafy vegetables, whole grains, and avoid dairy. Third is weight gain. This is a common side effect. Do not stop taking lithium because of vanity and not wanting to gain weight. There are ways to manage this. Exercise, eat a low-calorie diet, and just be healthier. Report weight changes to your prescriber. This is important. So monitoring yourself, monitor your weight regularly, and report changes to your provider. All right, third slide of third key objectives, distinguishing 3 serious side effects. I wanted to capture this citation for a second. Chronic overmedication is the leading cause for lithium toxicity. Severity of toxicity, unrelated. Severity of toxicity can be acute or chronic, but severity of toxicity is categorized into 3 tiers, mild, moderate, and severe. And that's what we're going to look at. So first, serious side effect that's going to be in our mild phase. And remember, we covered those numbers. This is the number from 1.5 to 2.5. You will have severe nausea, severe vomiting, and severe diarrhea. Actions that you can take, sipping clear fluids slowly, increasing the volume of your fluid you're taking comfortably. Also, another action, call poison control. Ask for remedies about lithium metal poisoning. All right. Another action is levels above 2.0, and this isn't really done by you, but something you should be aware of, like when you're going to the hospital. A level above 2.0 that they will test for may require dialysis to remove lithium. Fun fact. 2, fast beating heart. So, you can time yourself. You can time your own heart rate. You use your, right here, radial pulse. Have someone else do it for you. What you're going to want to do is count for a whole minute and see how many beats your heart was beating. Anything over 100 is problematic. So moderate phase is those levels, again, are 2.5, 3.5. We've jumped up. This is life-threatening. Action you should take is really call 911, call poison control, and go to your nearest ER here. Again, action for all 3 is to get medical help. That being said, you can also drink more water. You should avoid stimulants and avoid exercising, anything that accelerates your heart rate further, and use relaxation techniques. Mindfulness is proven to reduce heart rate. Deep breathing goes with that. So breathe deeply. It's going to be okay. Relax. Don't get anxious. Third one, seizures and fever. All right, so seizure phase, severe phase is above 3.5. This is very life-threatening. Actions required for seizures. This is something that you should probably teach your friend and family. It's probably not something you're going to be able to manage on your own. You're going to want to ease yourself to the floor if you can, and then have somebody gently turn you to one side. This is important so that you're not aspirating, and it's the best you can do. So, action for fever is a little more manageable. Drink cool water. Stay cool. Take your temperature. Anything over 102 is absolutely dangerous. Cooler air. Move yourself to a cooler environment. Take lukewarm baths. I initially thought ice baths would be the way to go, but I couldn't find any evidence for that. So everything suggested lukewarm baths. So we're just talking slightly lower than 90 degrees. Less clothing is also very important, or light clothing, what have you. Again, let's talk about this number, 911, you know. Poison control, number you may not know. Commit this to memory. It's actually not hard. 1-800-222-4112. I said 4 like the preposition, but let me try again. 1-800-222-122. All right, and kind of think about toxic. Starts with the level T. 222-1222. Go to the nearest emergency room. Cannot stress that one enough. All right, now for the fun part. We are going to be discussing the 4th key objective. These are activities that help your bipolar systems that are non-medication related. Get active, get creative. This is where you have fun with it. Bipolar is don't let it define your life. Get engaged. Exercise may improve your mood. Almost always does, but we have to use our disclaimers. May improve your mood. May lower feelings of depression, and it may help sleep hygiene. There's plenty of research to suggest this. Sleep hygiene is essential for treating bipolar 1 disorder. If I haven't talked about this enough, this is a very, very big component. Getting less than needed sleep can be a trigger for mania. Again, getting too little sleep will trigger your mania. Make sure you are sleeping an adequate amount, that being 6 to 9 hours, whatever your body needs. But it needs to be a substantial amount. Certainly not 3 hours, which is kind of prone to manic episodes. Regular sleep abates mania. So, keeping a mood journal. This is very effective. On a daily basis, jot down what's going on. What made you feel better that day? What made you feel worse? Focus on the positives. Write them down. Capture your life. Remembering bipolar is a serious mental illness. So even with all of these non-pharmacological actions, it is very important to understand that bipolar is chronic. It is not going away. You have to take your medication to get better. You risk serious injury, social isolation, because, I mean, people don't want to be around a crazy person, and incidences of suicide increase when left unmedicated. Again, avoid alcohol, marijuana, and illicit drugs that lower lithium's effectiveness. These affect brain chemistry. Lithium is a tiny, tiny, tiny atom. It goes everywhere. It can go into your brain. These drugs already affect your brain, so it kind of blocks lithium from doing its thing. Another thing that I really wanted to focus on is that you are not alone. This occurs to a lot of people. There's plenty of support. There are magazines out there. There's one called BP Hope. There's a website called BP Hope, Bipolar magazine. It always features a celebrity who's going through the same thing you are. This is fairly normal, okay? It's treatable. You're not alone. Reach out. Get some support. Support groups are available. Speak with your college health counselors about therapy. And now with the COVID universe, you don't even have to leave your house. Therapists come to your screen. So very important note, symptoms of depression are, I'm just going to read this. Symptoms of depression are associated with bipolar disorder, manic depressive, and can be an expected side effects of lithium treatment. Normal to feel a little low. If you are experiencing any suicidal thoughts, help is available 24/7. National Suicide Prevention Hotline is 1-800-273-TALK, which is also 8255. Again, that is 1-800-273-TALK. Contact your prescribing clinician or therapist should you find any changes in your mood that are concerning. Contact 911 in an emergency or go to the nearest emergency department when feeling suicidal. Your college campus may also provide assistance, so please identify those resources, list them out. This was a study done by National Institute of Mental Health. These are things students can do and they have access to. All right, we've reached the end. Thanks for toughing it out with me. Let's go ahead and take this moment to recall, understand, and evaluate those 4 core client objectives we have talked about. Again, this is a great little quote. Clients' lithium knowledge positively correlates to lithium levels that are more stable and within the higher end of the recommended therapeutic range. You only get better by what you know. So, that being said, which 3 do-nots were identified? Take a moment, think of that. What 3 factors helped improve compliance? So, how often should you have your blood drawn? I'm just tossing that your way. And why is this necessary? 3, how will you distinguish side effects? What's a common side effect? What's a serious side effect? How are you going to manage them? So I asked the question, take a moment to answer this. How would you manage constipation? And after doing so, name 2 side effects that require immediate medical attention. Okay. And then lastly, get creative, get active. What 2 activities are you going to commit to staying healthy? Okay, and here are my references. This is a data table that you may find wildly unnecessary, but for my nerdy pre-med and chemistry majors, y'all gonna find this interesting. So take a look at this when you get a chance. All right, and this is the end. These is a list of written and image references that I've provided. So that being said, this is going to be on a YouTube format, so you can go ahead and place any questions, comments, and the answers to those 4 key objectives in the comments below. Thank you for your time. Take care. Stay healthy. You're not alone.